When you start reading this book, you will realize that 50% conditions, they are your diagnosis. It is your diagnosis. You will see that, oh no, I have this disease, right? Then by the time you reach hopeless chapter, you have read the schizophrenia, personality disorder, all those bad, terrible diseases, conditions. Okay. And you see, yeah, I have one member in my family who has that condition. Yeah. And most of the people know who are married, who is that one person. Either it is mother-in-law or it is husband, the poor husband. Yeah. Husbands don't typically diagnose wives with schizophrenia, no, with personality disorder. They diagnose with schizophrenia, paranoid, like suspicious wives, paranoid schizophrenia, and all those. So we do that often. We means other, I'm a good husband, okay? I don't do that. Even if I diagnose, I keep the diagnosis with me. I don't say it out loud. Okay. I tell students that you should say it out loud when you're fighting it. Okay. And if you fight, then next step is you need to identify why we are fighting. This is very wrong. We are fighting for some reason. So there has to be reason. How to identify what is the reason? Then you read this book, Relate Pillar, Marriage Relationship Counseling and Relationship Test book. In this book, you learn 25 relationship tests. Okay. In this, you will find out why we are fighting, why couple are fighting, what is the problem, whether there are 25 pillars for a relationship. So which pillar is about trust, respect, love, goal sharing, financial goal sharing, compatibility, affection, how do you express affection, communication, all those things. So there are 25 relationship pillars, relate pillar. I have called them relate pillar in this book. And then I have given one story for each relate pillar, relationship pillar. The name is relate pillar. It is my trademark. Okay? Relate pillar. And the next is for each relate pillar, I have divided into 5 components. And each of the 5 components, there are questions. So total each relationship pillar has 30 questions relationship test. So you will be able to identify, for example, trust. So trust has to be, okay, whether my spouse has won my trust, whether I trust my spouse, whether my spouse trusts me, whether we mutually trust, there are components of it. Right? For each of them, there are questions. So you can identify if someone says, I don't trust you, or we have a trust issue. Okay, within this trust issue, what is your component that is problem? And you will learn in this by using the relationship test. And after this, then how to solve it. Solve will be by couple activities. So you learn around 100 couple activities, right? What is it? Couple therapy with fun activities. So you will learn couple activity for solving each of the problem. Both these books are part of marriage relationship counseling and family therapy program, right? If you wish to learn this, if you wish to identify why you are fighting, you should use this relationship test. In the disclaimer of this book, I have written, you should not use this test on your own self, okay, in your own marriage. You can use it on your clients because, already you are trapped in the marriage. Now, if you run a test and you find out, oh no, compatibility is the issue, you cannot do anything. Yeah, you cannot fight with your parents with whom have you tied me for the lifetime. You cannot do that. It's okay. So you're already trapped. No problem. You can still help other people, conduct the relationship test before their marriage. Tell them you're not compatible. If it is already marriage has happened, then tell them how to improvise the compatibility. Yeah. Don't tell them that you are not compatible. It's very bad. Unless you are a lawyer also. Yeah. So there are typically marriage counseling program is taken with us. Many lawyers, those who have marriage counseling service, they take because they want the certificate to be put in the chamber, and they also want this access to this content. This is our copyright content, not available on outside. On Amazon, this book is there. Now coming back to the book, this is a diagnosis of ADSD. When you are talking with something and then you start fight, then you start talking of the relationship test, then you start talking of couple activity, then you start talking of divorce lawyer. This is a classical diagnosis of, write down what is your diagnosis. ADSD. Good. So I asked the question, what is your diagnosis? It means you have this condition, ADSD. I don't have that. Okay. And I don't acknowledge. Because I don't acknowledge ADHD, that's why I'm good. Yeah. So if you have a child at your home who you think ADHD, don't call the child ADHD. Otherwise, this child will not grow. Yeah. OCD, yes, I have OCD also. Very good, Divya. Okay, Divya has OCD. Divya is saying that. Okay, very good. I thought Divya did my diagnosis from my last call. Yeah, or some message you sent me, some grammatical mistakes in the message. I was like, English, speak English. Yeah. OCD also has its positive things. Okay. So today we will learn, if you have a client with OCD, what should you tell the client that you can live a normal life? Okay. OCD has its benefit. So if you have OCD, you are very systematic. You better look for a career which involves systematicness, arranging things, arranging files, documents, working things systematically, being a project manager, being a business analyst, right? All these are more suitable roles for you. A writer, a painter, all these are very suitable roles for OCD. Don't treat your OCD unless you have dysfunction in the society. If you treat your OCD, your skills are gone. What are your skills? To be organized, to be systematic, to be so much obsessed that you want perfection in things. If you take medicines for OCD, that you will lose your skills. So you need treatment only as long as there is a dysfunction. You cannot treat OCD. It is going to be there. With some medicines, you can suppress it. But this suppression is required only if you have dysfunction. What is a dysfunction in OCD? You are getting irritable. You are getting depressed. You are getting anxious. You are fighting with people because they are not organized. You have to accept that you have the OCD. The people around you, they don't have. They are going to behave like they're normal human beings. And for you, being OCD, your normal is different. But you have to accept that abnormal also as a normal. Other people, they are not so much organized. That thing you have to accept. If you're fighting with other people, that they must be also organized like you, that is the time you need treatment. You understand? So OCD is not a disease to get rid of. OCD is a gift. You use it. But if you are troubling people, so other people surrounding you, that their life is like hell, so then you need treatment. Okay. So if the mother comes to you and says that the child is behaving erratic or something, sometimes very something. So many of the times the mother needs counseling, okay, not the child. Yeah, all teenagers feel that their parents have OCD. Very good. Probably they also have. It's hereditary, running in the family. Then, in this scenario. Now, ADHD also, I have seen many parents, what they do, they come and they say, ki, my daughter is taking medicine for ADHD, OCD, anxiety, depression. What is the age of your daughter? 8 years, 12 years. She's taking since 6 years, 3 years, 4 years. What stupid parent is that? What unethical counselor is that? What psychiatrist is that who has started this medicine? Typically, a psychiatrist will not start at such age. They don't do that. A proper MBBS and MD psychiatrist, I'm talking, okay? So there are many people sitting in the market, even without they are giving medicines. So that is wrong. So ADHD, you don't need medications immediately. If it is completely out of control, right? You are completely very impulsive and you are doing things out of control. You are completely hopeless case, gone case. Then probably you need medicine for ADHD. Otherwise, not required because you have to learn to live with that. Okay. There are some people with born with certain conditions, right? You may have a higher IQ. You may have an average IQ. So you have to learn to live with average IQ. You cannot start brain replacement, transplant, or some medicines to increase your IQ. You cannot do. You have to learn to live with that. Same is you have to learn to live with ADHD and OCD. Now, today only I had a discussion with one of the students, and she was saying that it seems everyone has bipolar disorder, including me also. Me means her. So I said, yeah, actually, bipolar disorder is very common. Yeah. So the problem is lack of diagnosis, lack of awareness. If any one of you, most of you, or your spouse, okay, you feel that there are some days where you feel down, 2 weeks down, 4 days good, 1 week good probably, then again down. Then suddenly you feel that you were down and suddenly there is a light. Okay, you feel brilliant in your life. You feel that you have come out of a tunnel. You were inside the tunnel, complete darkness in the world, and now there is a light in your life, and then suddenly again darkness goes. Is it happening with you? Yeah. So if it is happening with you, don't write in the chat, just, and don't nod your head because your husband is listening. Okay. So just blink your eyes. Yeah. So it means you have the bipolar disorder. Only you and me now know. Your husband should not know, because then that becomes a, yeah. So that becomes this marriage counseling, divorce. Yeah. And if you are probably going through divorce after next 5 years, there is a likelihood chance 1%. You should not diagnose yourself anything. You can diagnose your husband, because these are the things can be used in child custody and marriage fights, all those stupid things. Yeah, the reason for divorce and all. So insanity is one of the reason for divorce. Don't forget. So never say in front of your anyone that you have this condition. In front of others, you should say you have this condition, and don't give easy diagnosis. Easy diagnosis you reserve for yourself. All difficult diagnosis you put it on others. Okay. So now write down which are the easy diagnoses according to you. So that's why I will know that this is the conditions you are good with writing yourself. Depression is easy. Okay. Keep writing which are your easy diagnoses in the book. And anxiety. Hey, autism is easy. What are you talking, Ayushi? What has happened? Someone? Huh. Okay. Huh. For someone, if autism is easy, then respect. Respect. Very good. Okay. Very good. Easy diagnosis. Anxiety. Almost everyone in the world goes through anxiety at some point of time, because you had some emotional trauma or because you have fear of future. That is the reason for anxiety. Stress. 100% people, they go through stress at some point of time. Okay. No one can say that I have no stress. If you say this, if someone says this, there is only two possibilities. One is you don't know that you have stress. Yeah, you are so much ignorant. Or second is that you are foolish. You are silly. You are a child. You are happy. If you second is the thing, you are good. You are lucky actually. You are still a child and you feel that you don't have stress. The child doesn't have stress. Yeah. The child is happy. The third, anxiety, generalized anxiety disorder, which goes to panic disorder, right? Common is generalized anxiety disorder, stress, panic disorder, OCD. OCD is also relatively common. 40% people, 30%. At some, they will have some component of it. Right? 5, bipolar disorder. Very common, but underdiagnosed. Because you see people going through the down phase, coming out, you see that, oh, these are the mood swings. These are PMS. They are linked to your some monthly cycle. Right? So many times you label it to that. And many times you label it, yeah, there are days when you feel down, things are not going good. No, actually you are down. That's why things are not going good. So you are going through bipolar disorder. Then another common is minor depression. Okay. Also, remember, any of this condition, never call them psychological condition, mental condition. Hey, tell me what is your mental psycho condition. So you always call it a good word, emotional turbulence. So it is a friendly, people will like it. Most of your clients would not have heard of this term and they would like this. Oh, this is a new counselor. She is using emotional turbulence as a word. And educate the client. See, all these anxiety, stress, depression, minor depression, OCD, bipolar disorder, they were there in your genes earlier also, but they didn't exhibit. Now tell me, when was it when you started experiencing this? What was your age? Teenager, childhood, 20 years, first breakup, second girlfriend, first marriage, the next day of the marriage. When was it started? First child. Yeah. So when did it start? In-laws moving together. So what are your trigger fact? What was your emotional trauma? What happened in your life that you have started exhibiting these symptoms? You were a OCD as a child also. You had ADSD, but that was not affecting your life. You still had minor depression, bipolar disorder, but you were living your life. There happened some emotional trauma in your life. That's why this emotional turbulence got so much that your life is affected now. So this is emotional trauma. Now, what is the meaning of dysfunction? Either you are a student, you are not studying. You have an entrance, you are not studying. You are supposed to earn money, you are not earning. You are supposed to provide for your family, you are not doing. You are supposed to do something for your own growth, you are not doing. And obviously, if you are not taking off your personal hygiene and all those things, so that is a diagnosis is hopeless, depression, major depression, all those things. So even before that, all those things are counting as dysfunction. If you think you have a caliber to earn 1 lakh and you are earning 20,000, you are not shifting your job because you have a fear, because you have a stress, because you have anxiety, right? All those things, right? Now, this is emotional trauma, and these were symptoms or emotional turbulence. There is in middle that is called trigger. Emotional trauma, betrayal, something happened in the life, some circumstance that affected you so much, these symptoms started coming up. But there is something called trigger. So what is trigger? You were good today, but suddenly you thought of the exam. That thought of the exam is the trigger. Okay. Now you were good, but suddenly your manager scolds you, and sudden you have this hyperactivity. You go home and shout at people. Okay. You have fight with someone, arguments with someone, something goes bad, not expected as you. This will be called trigger. So you are living a normal baseline. Probably baseline for someone is this: happy, normal, high emotional bank balance. For some people, baseline is less. They have low emotional bank balance. So if something happens to this person, they are not affected much. They are affected this much. Okay. But something, same thing happens to this person, that person is affected like, ooh, right? And very bad. Okay. Everything derails now. So for this person, emotional bank balance is low. So if you are here, then small triggers will also affect you. And you need to do two things. One is you need to increase your emotional bank balance. Number two, you need to heal your emotional trauma. Okay. I will tell you one simple formula. Stop writing. One simple formula. Any client it comes to you or yourself, you ask, there was an incident which happened 18 months back, before 18 months, anytime, 2 years, 3 years, 10 years, you still have flashback of it. You still have, you still are affected by it. There is a trigger factor happening in the present life. That trigger factor is linked to that emotional trauma. It means you are going through PTSD. Very good, Dipti. Right? So 18 months have gone. You are still getting images, flashbacks of that memory. You are still affected by that memory. Your reaction, your response is different as compared to a normal. Your normal. Okay. And this is PTSD. There was an event which happened before 6 months before, and you are having dreams of it, nightmares of it. And those dreams are not pleasant. Probably you do not remember the dreams, but you remember something unpleasant happened in my dream. Yeah. Your subconscious mind knows. You need healing for both these things. It was such a traumatic event that you need healing. Okay. So we start with PTSD today. What is the page number? Can anyone help with the page number? Who has written the index or found the index of the book? Is it after OCD? Yeah, seriously. 90. Okay, it means there are different versions of the book you have. That is the only diagnosis. Yeah, in my book also 96. I have the recent version now. 96. Okay, some people have, okay, different. 280, 90 approximately. You search whatever version you have. Okay. Hmm. Okay, stop chatting. It's okay. You won. Yeah, in your book, it is the diagnosis. We know everyone OCD. So, but now come to PTSD. So, PTSD means I will tell you, stop writing now. Simple diagnosis. Pay attention very carefully. So, don't read anything. Okay, don't go with a theoretical definition. So, in the book, it is a practical definition. How do you diagnose PTSD? There was an event which happened 18 months back, you still have flashback. There was an event which happened 6 months back, you are getting dreams which are not pleasant. Okay. There was an event which happened earlier, and now your reaction for particular thing, a trigger, it was different. Probably you would behave in a particular way, but now you are behaving in a completely different way. Right. So that is also comes under PTSD. So a memory, a image, a flashback, or similar event that affects you negatively, that creates you dysfunction, that is PTSD in a simple word. Okay. So what will happen in PTSD? You are gone through such a traumatic event that has affected you so much that now you are like a crumpled, completely broken, crumpled, completely. Okay. So every time something else happens, this is trigger. So you feel completely affected by it. Okay. But here, this, even if you open it, it is not going to be completely wrinkle free. Okay. That's why you need healing. To heal this, what you need is you need to replace this traumatic memory with good images. How are the memories stored in your brain, in your mind? Images. They are not written word. So you need to change images. You need to do neuroplasticity. PTSD can occur because of natural disaster, crime, some violence, witnessing a crime. So many times, if something is happening, we try to avoid children in that scene. Okay, if husband, wife, and fighting, if children are watching, that is going to cause PTSD. Yeah, yeah. You are seeing, looking at your husband. Very good. So some accidents, any traffic accident or anything. Now you had accident and you recover after that, and you stop using that vehicle, you stop driving your car. Actually, you are going through PTSD. If you want to overcome that PTSD, the only option is you need to start driving again. Okay. You were fired from a job and now you are afraid to look for another job. You had a divorce or a betrayal in your relationship, infidelity was committed, and now you cannot start trusting anyone. You cannot get into a relationship. So this is also PTSD. So healing PTSD, it needs lot of psychotherapy techniques, lot of healing sessions for change of their images, for increasing emotional bank balance, and for change of their neurosynaptic junctions, so that the response is different now. Okay. So what happens in PTSD? There will be flashback, there will be nightmares, intense, unpleasant memories, images, or thoughts. Simple ways: flashbacks, nightmares, unpleasant memories, and either emotional or physical distress when you are exposed to the similar event. That is a problem, that exposure therapy doesn't work. If someone is afraid of something and you say, no, no, you face it, no, that person will suddenly have bouts of everything. And that person will drop out now from your therapy. Okay. The exposure therapy does not work. And even if you try for 5 times, you do not know whether this person, like for example, one person is afraid of certain event. You say, no, no, you go face this event. Problem is, you don't know whether facing it one time will help or 10 times you have to face it. There is no study that, and every person is different. Someone might need 5 exposures. Someone might need 10 exposures. So if you have a person who needs 5 exposure and they are exposed to the same event 3 times, everything is now in the conscious mind. Whatever the memory was at subconscious mind was affecting, now it is in conscious mind because of the 3 time exposure to the same event. Whatever that was images were there, they suddenly come to your conscious mind, and you will have overwhelming anxiety, depression, stress because of that. Overwhelming emotional distress. That's why exposure therapy fail. Okay. That's why cognitive behavior therapy fails in this area. That's why you need subcognitive therapy, which acts at the subconscious mind. Now, how typically a patient comes to you and say that they are having this symptoms? So typically they will say, they will start with that there was this event. After that, they started having flashbacks. Whenever something happens similar to it, they start getting sweating, they get palpitation, they start overthinking, they get so much afraid, they are in shock, they cannot move, they cannot do anything. Okay. Suddenly their happiness is gone. Suddenly they lose hope. Suddenly they get afraid. All those symptoms they will say. They might have chest pain, stomach ache, all the body may have pain except tongue and hair. So these people typically complain of all those things. If it happens in children, they may exhibit bedwetting, they may exhibit isolation or separation anxiety, or they may exhibit extreme irritability. Okay. Now, there are milestones for a child. They will wet the bed till 1 year, 1.5 year. With proper training, they stop doing it. Now, there was a bed wetting till 1 year, 1.5 year. They stop bed wetting. Suddenly, there is a start of bed wetting. Don't put it lightly. Evaluate. If the child was comfortably independent and everything, now suddenly the child doesn't want you to go to office. Don't go to office that day. Yeah, it doesn't happen. Tell your manager, I'm not coming to office because my child doesn't want me to go. You can deduct my salary, keep it. I will give you 500 extra salary. Yeah. Because there is something else going on now. Okay. It may be nothing. It may be the child wants to play just with you, or the child has nothing. But it's okay. You use it as an opportunity to play with the child. But if the child is completely having separation anxiety with you, there is something you need to do for this. Okay. Number 3, now, if you have question to ask, you're raising the hand, please start your video first. Hidden faces, questions, I don't like. Okay. And if you don't want to start camera, then you can write your questions in the chat. Now, for every child, there is a childhood milestone. At this age, the child will start talking. At this age, child will crawl, will walk, will run. Now, imagine the child has a development going on following all the milestones. And one of the milestones, they reverse back. So you need to evaluate what is the reason. It can be autism, it can be developmental delay, it can be some abuse or something. You need to evaluate now. Okay. Some people, to escape from the reality of facing the PTSD or the associated images, they go to negative coping mechanisms. So negative coping mechanism can be promiscuous behavior, risky behavior, alcohol or drug abuse. Okay. Please repeat that question. Yeah. So how do you confirm the diagnosis of PTSD? Typically, client will start with this story, emotional trauma. That is number one. It should be there. There should be clear-cut, demarcated emotional trauma, which the client acknowledges this is the reason. The same emotional trauma, either it is getting triggered by something, or still the client is having memories of it or flashbacks of it. 18 months have gone, 6 months have gone, and nightmares are there. And number three, the client has clear-cut dysfunction now. Either the client is withdrawn, extremely anxious, crying, has a lot of fear and depression, all these things. Whenever the trigger happens, the client gets physical symptoms, sweating, body cramps, pain, any part of the body, or extreme discomfort. They don't know what is it, but they say घबराहट हो रही है. Typically they say this word घबराहट हो रही है. Okay, so you know what is a diagnosis. One of the factor is that this symptom should persist for 1 month. Okay. Now, when you are taking up a client of PTSD, you explain them. Number one, you explain them what is PTSD. You explain them that there are emotional trauma, which as you are described, there are trigger factors which you want to prevent and avoid now, as of now, unless you get healed. And because of these trigger factors, you are having these symptoms. You tell them very clearly. Number one priority is to avoid these trigger factors until you get healed. Number two priority is increase your emotional bank balance. So there are techniques to increase your emotional bank balance, which you learn in Sunday classes. Then you need healing at this place, emotional trauma. Now you explain the client. Now you explain to the client. There are three types of emotional trauma. One trauma, which is long forgotten, deep buried inside, and you are not affected by it anymore. So better you leave it like that. Second emotional trauma, there was a trauma you had, but you are utilizing for your growth now. You are using it for your benefit. Good. The third is the emotional trauma which is affecting you presently. Right? It can be a very silly thing that there was an embarrassing moment, but you are still affected by it. Not necessarily it is a PTSD, but still you are affected. Right? On a daily basis, you are having fear, anxiety. Emotional trauma can also be some of the parenting methods. Right? So you are so ambitious, you want your child to be all-rounder. Many people do that. I want my child to be all-rounder. Actually, you are not all-rounder, you are a failure. And that's why you want your child to be all-rounder. You want to fulfill that dream. What they do, okay, don't miss your school, don't miss tuition, don't miss concert, don't miss music class, don't miss games, don't miss this, don't miss social event, don't miss friends, don't miss family. So what you are doing over the year when the child is growing, you are teaching the child, don't miss this, don't miss, don't miss, don't miss, don't miss. So the child has developed now the fear of missing out. The child is afraid now. When the child becomes adult, you have to prioritize on your earnings, on your growth, personal growth, plus your family taking care of everything. You cannot continue doing everything. So when they grow as an adult, they will be afraid of losing out on things. They will always have fear of missing out. You understand? So they will always be afraid, oh my God, I'm going to miss something. I'm going to miss something. Now, there are some children who grow as an adult, they don't know what they're afraid of missing, but they're afraid of missing something, FOMS, right? Fear of missing something. FOMO is fear of missing out. But fear of missing something is far more terrible. You don't know what you are afraid of missing, but you are still afraid of. So don't try to build your child all-rounder. Yeah. It's better to focus on two things, one thing, three things. And that is the parenting trauma which you are done. Okay. I will give you a very easy example. When the child is young, breaks a toy, you tell the God, you were in a different room, there are two siblings. You suddenly come in the room and ask, hey, who broke the toy? I'm going to kill you. Now the child thinks, oh no, if I tell the truth, I will be killed. So the better is I put the blame on the younger child, or I put the blame on the elder child, or I say, I don't know because I don't want to die. They don't know. So that is how you traumatize the child. Yeah. Now You were doing something in the kitchen, the child comes to you. You are in a bad mood because you had a fight with your schizophrenic husband, and the child is appreciating you or wants to learn something new or talking to you. Suddenly, you scold the child. Next time, this child will not come to you to learn something new or help you in the kitchen or will not appreciate you. Yeah. Or this child will not learn something new now. There will always be fear. Yeah. Yes. Yes, Amita. So as a parent also, you are instilling all this fear and some of the PTSD to your child. Okay. I will give you one more example, very common. One time the child fails in the class. One time the child doesn't do good in the board exams. You beat the child. You scold the child, do not give food, punish the child. Now the next time the child is so much afraid to bring up a report which says failure or not A plus. Yeah. So actually, that is also PTSD. Do you know that that event happened 2 years back? The child is still afraid, and the behavior is lying. Manipulation is the behavior. Okay, so don't traumatize your children like this. For now, PTSD, there are some therapy modalities. Number one, breathing exercise that helps, or pranayam, it helps to increase your emotional bank balance. Number two, some of the psychodynamic methods which increases your emotional bank balance mentioned in the book, taught in Sunday classes. Number two, cognitive behavior therapy. But when the person is so much affected that they are so much anxious, have low willpower, low confidence, all those things, low self-esteem, and you tell them, okay, you go this, fill this worksheet, this is your assignment, do this now, they will not do. They drop out. Okay. So it needs a lot of motivation. It needs a lot of cooperative clients. So out of 1,000 clients, probably you will get one client like that. The remaining 999 clients, they don't follow cognitive behavior therapy. Number three is prolonged exposure therapy. Prolonged exposure therapy works only if you go till the end. If you're doing exposure therapy, a client may need 5 sessions, 10 sessions. So you have to complete all the 10 sessions. You cannot drop out at ninth. If you drop out at ninth, your all this trauma at subconscious level comes to conscious level continuously. Earlier, you were affected little bit intermittently. Now you will be affected every second. Earlier, you were affected 50%. Now you will be affected 200%. Don't do that exposure therapy unless the client agrees. No, even if I die, I come to you for 10 sessions. My ghost will come to you. Then, okay, good. Take the money for 10 sessions. Okay, even if you die, I will do the sessions on your ghost. So that is a prolonged exposure therapy. Otherwise, you go for psychotherapy, neuroplasticity for healing at subconscious level, right? So you need healing at subconscious level, emotional trauma, and you need certain techniques which will heal them, the images, the memories of that. Okay. You need certain techniques for increasing their emotional bank balance and healing their emotional trauma. Then only PTSD can be solved. Okay. Don't think that PTSD is always about war, death, killing, something bad. No. PTSD can be because of small things also. If a child is afraid to bring you the report card of failure, yeah, so that is also a level of PTSD. Yeah. If you are afraid of getting into a new relationship because someone else betrayed you, that is PTSD. If you are not able to trust on someone new or anyone, yeah, because your employer, manager betrayed you, that is PTSD. You go on a vacation, you have flashbacks of those memories. Yeah. Your vacation is spoiled, mood is spoiled, that is PTSD. Very good question. So, good, Arpana. So, stage fright as such is not a PTSD. But if someone as a childhood or as an adolescent went on a stage, was bullied there, was embarrassed there, and after that you stop going on the stage, then you can call it. Because there was a traumatic event which is now leading to dysfunction. And every time now you have to go on the stage, that dysfunction arises. Okay. This is PTSD. But other aspect of stage fright can be you didn't practice, you didn't do it. Okay, people are not born with the stage daring and all. So you have to practice with a small crowd, 5 crowd, 2 people, and slowly go on to next level. Correct. So anxiety disorder should be a preferable diagnosis for stage fear. Good, Dipti. Well, now there was a question like which are those modalities of psychotherapy, psychodynamics for PTSD. It is mentioned in this chapter also. It is also mentioned in the panic disorder chapter. You can read that. And if you are interested, then you can talk to me. I will tell you one story. Now stop chatting and writing. Okay. You can take your child also for the story. Okay. There were two soldiers in the World War. Both were captured. Yeah. Both belong to different countries and they were captured in Japan. Okay. Now both got released after 20 years. Now they don't know where is their family, whether their family is alive or not. Both have to go to their own countries. And now one soldier is saying to the other soldier, I cannot forget these people, what they did to me. I was locked up for 20 years and now I don't know what I have to do. I can never forgive these people. Yeah. I hate them. And there is no way I can take a revenge, or probably if I get, I will take a revenge. Okay. Vengeance, hate, anger, frustration. Okay? So the first, the other prisoner, he says, I'm forgetting everything. If I have vengeance against them, if I have anger against them, if I have frustration against them, it means I'm still their prisoner. My body is released from the prison, but my mind is still in the prison. I'm still thinking of these people, my enemies. No. To move on in life, I will have to erase that 20 years memory. I will have to start living again. It is my second birth. I will have to forget it. I cannot hold anger. I cannot hold vengeance. I cannot hold frustration. Then only I am free. So, what is the difference between you and me? Your body is free from the prison, but your mind is still in prison. And today I am free. You liked it? If you like this story, write in the chat, comment, you liked it. And who are you? Your mind and body both are free from the prison, or your only body is free, mind is not. It's not necessarily a prison. It can be prison of a bad marriage. It can be prison of a bad childhood. It can be prison of a bad job, bad work environment, any of these things. It can be prison, small prison, 1 year, 1 day, some bad experience. So are you still holding grudge? Yeah. Are you still angry? You are still affected. Your enemy has done a very good damage to you. Right? The damage is so good that your enemy has won today. Yeah. So if you are watching the YouTube, write in the chat whether you have won or your enemy has won. Or from now onwards, you try to win. Yeah. Till now, your enemy had won again. So you were earlier in a bad relationship. Now you got a good boy, good wife, and good family. Still, you do not acknowledge, you do not realize, and you do not accept, and still you continue to behave bad, react in a different way. Because that earlier person has traumatized you so much, that earlier person has successfully done his job to traumatize you for the lifetime. Yeah. So you have to come out of the influence of that person. Yeah. There are some people who are thinking, yeah, it happened with me, and there are some people, yeah, actually, I did that with someone. Yeah, both the type of audience is here. So write down in the, if you're watching this video, write down in the comment, which are you? Who are you? Whether you were in the prison or you put someone in the prison, yeah, successfully. So the prison of mind is a stronger prison. You can write, the bold people will write. Yeah, I put some people in the prison. Yeah. So it's both. Okay. I like the sincerity of the answer. It's okay. I will tell you one more story. It's almost 10 years now. Okay. I had the organization which I worked with was very good. Yeah. That 10 years back. Very good organization, lot of learning, everything. People are good, culture is good. Only my manager was bad. Okay. So every time I have a presentation in front of 100 people, 50 people, 10 people, he used to say something that used to disturb me. And I was like completely hell bent. I will not get disturbed. I will do something that you get disturbed. Okay. So I don't know what I used to say, but then he used to like kind of cry in the corner. Okay. Because his objective was to say me something that I get disturbed for the presentation. But I used to say something back so insulting that he cannot stand in front of 100 people now. Okay. But when I left that job, okay, I appreciated him. And people were like, hey, he used to behave so badly with you. He used to deduct your salary and used to do mean things with you and write to director about you and all those things. So why you appreciated? I said, I want him to continue doing his mistakes. I don't want him to realize that what a monster he is. And that is his punishment. And he would have succeeded if I take this trauma with me. I do not acknowledge. Till today, I do not have any memory what he used to do. Okay. And I used to think it's his nature. It's okay. It's okay. Someone betrays you in your life. It is going to happen. Don't think that you are a good person, you are a vegetarian, so tiger will not eat you, lion will not eat you. It's not that. Yeah. If you have not hurt anyone, it's not that scorpion will not beat you. It's not that. That is a nature. People are going to hurt you. People are going to betray you. Now, if you hold it, someone betrayed me, I will take the revenge. You are the prisoner. Your enemy has won. But if you leave it, it's okay. It's a part of the nature. It is expected in life. Some people I trust, they are betraying you, going to betray me. A person you do not trust cannot betray you. Remember this. When you sometimes say, I trusted you so much, how can you betray me? Yeah, actually, you got betrayed because you trusted. No one can break your trust if you don't trust. Yeah. You cannot be betrayed by a person you don't trust. Yeah. So, yeah. And it is going to happen. People surrounding you, people, those you think they love you, people you love so much, people who are good with you, it is expected. Some of them are going to betray. It is a part of life. And your enemy has won if you hold it. You don't need to do anything. Forget it. You don't pray to the God something bad should happen. You should not say by your mouth or in your heart, bad people will get bad thing. Yeah. If someone does bad to you, write down very sincerely. If you're watching the video also, a recording, you can write in the chat. How many of you want other to know, hey, this is your mistake. This is bad. This is your mistake. Yeah. Your husband does something wrong. You go through some difficulties. A manager does something wrong with you. A neighbor does something wrong with you. You want them to realize this is your mistake. How many of you do that? Yeah. You want other person to realize what is your mistake. You want to prove this is your mistake. You want to fight. You want to burn your blood. You want to die to prove that. Yeah, you fight, right? You fight with yourself. You show anger and all. I will tell you better way. Okay. The benefits are two. One is if you don't tell this other person what is their mistake, I will tell you both approaches. When you should tell, when you should not tell. Okay. So now again focus. Again focus. Stop writing the chart. There are scenarios where someone does the mistake. You are tempted to tell them you did this wrong. You want to tell this. It is correct approach, and you should not tell this person that you did this mistake. Both the things will take together. The person who loves you, you love, no, non-considerate, not material. The person who loves you, the person who cares for you, the person you want to continue in your life, you tell this person, this is what you did wrong. It hurt me. Because you care for me, you don't want to hurt me. Because you love me, you don't want to hurt me. This was wrong. You change it next time. Right? If you love someone, but they don't love, if you care for someone, and that's why you want to correct them, hey, get out. They don't care what you are thinking. They don't care to hurt you. Yeah? So these belong to second class. People you love, but they don't reciprocate. People you care, but they don't reciprocate. People you are decided to leave, let them go, or you want to leave them. People who are not going to be part of your next journey, you don't want to correct them. You don't want to make them realize you did this wrong. You don't want to make them realize. There are two advantages. One is you win immediately because you are not their prisoner. You don't have desire to tell them you did this wrong. I don't care actually. Go to, yeah, I don't care because I'm no longer your prisoner. You say this statement, I'm no longer your prisoner. Okay. Today you write on a piece of paper, A4 size paper, write with the big words, colorful, I am no longer your prisoner. Yeah. Don't, in your mind also, this you, I am no longer your prisoner. Your means, who is this person? You should not know this. Yeah. If you think in your mind, this your means you, so it means you are still a prisoner. Yeah. So you have to go to that level. You're writing this, I am no longer your prisoner, but you don't know who is this you are. Who is this you? That you don't know. Yeah. So next time you face this scenario, say in your mind, I'm no longer your prisoner. I release you. Go to whichever spelling you want to say. Yeah. And don't correct them. Because if you try to correct them, that is a revenge actually. There is a vengeance inside you. That's why you want to correct them. I want to make you realize you did this mistake. Yeah. And you want to burn yourself for that. The second benefit is they will do this mistake again and someone will kill them. Yeah. So wait for that thing to happen. It's okay. Yeah. In the third aspect, you should not pray to God that something bad should happen. You should not think that he did bad with me, so bad thing will happen. If you still continue to think he did bad with me, bad things should happen to him, you are still PTSD, my dear. You are still a prisoner. So you have to let it go. Whatever happened with you, I don't care. Good thing, bad thing, doesn't matter to me. It's okay. And you continue doing your mistake. Right? You continue doing your mistake. I like that. I like that. Yeah. I will tell you one childhood story. I was in 8th standard. I remember this very clearly. I was in 8th standard. And like in our school was very small, a village school, no systematic. When the bell rings, everyone is like, so small door, and everyone wants to come out simultaneously. Some students they get hanged, they get stuck, right? So this motu boy, this girl, this boy, everyone is coming out together. Some people get stuck. Now there was one boy. He is like, you stop me going. Because of you, I got stuck. Now let me beat you. I was like, no, no. So he said, tomorrow is exam, and I'm going to beat you tomorrow. If you don't allow me to beat you now. I was like, okay, okay, today I will take the beating. So he beat me. Yeah. So I said, okay, one chance. Huh? Not two, one only. Okay. So he beat me in the back. Same thing. I was like, okay, I will not say anything. And somehow I forgot that incident. And I didn't have this that something bad should happen, something same thing should happen with him, or someone should scold him because my focus is exam. I cannot put my 5 minutes to think of that. Yeah. My focus is next day there is exam and I cannot score 99 marks. I'm going to cry. My objective is 100 marks. He is at 50 and so there is no thing. Yeah. He can put his whole night thinking that he took a revenge and he beat me. But I cannot put 5 minutes to think how to get back. So I leave that. Few days now, his confidence has grown very much. Yeah. Now, every time he's exiting the door, I'm like, hey, okay. Then one day he got stuck with another boy and he slapped that boy. And that boy did some kachumbar with him so badly. So you understood. If I would have corrected him that time, if I would have gone to my teacher and said that he beat me, that boy would have got corrected. That boy would have stopped. But my thing is, I don't want you to get corrected because I want you to repeat the mistake with someone else. Yeah. You cannot repeat the mistake with me because I'm going to be cautious of you, but I want you to repeat the mistake with someone else. Yeah. And I cannot put my 5 minutes time to think about it. I don't want to correct you. When you are in a good mood, I don't want to explain you, this is what you did wrong. I don't want to explain you. Because there is no way I can explain you. You can explain to this person what you did wrong, my dear. You love me, you care for me, you don't want to hurt me. This is the thing you did wrong. Will you change it? Yeah. Right. This person only I'm going to tell you did this wrong. Otherwise, no. I have not taken any obligation to correct the world. Okay. So all those bad people in the world, they can continue burning each other or themselves. I don't care. I have no obligation to correct people in the world. My obligation is with me. My number one and only objective is my emotional well-being. How can I be peaceful? How can I have peace in my mind, happiness in my heart? That is the only objective. If correcting the people in the world, like Dr. Chaitra has said, doesn't give me peace and happiness, I will not do it. Okay. Okay, Dr. Tripti has asked a very interesting question. What if the person who means a lot to you hurts you? So when I explain this person, where you are going to correct, this is not the person you love. Wrong. This is not the person you care. This is not the person means a lot to me. No, get out. You don't mean anything to them. Yeah. They are going to crush you. You don't mean anything to them. So you have to mean something to this person. Then only you will say. If it is a best friend, you think it is a best friend. Does she think you are a best friend? If the answer is yes, then you go and say, hey, you did this wrong. Acknowledge now, say sorry. If she doesn't acknowledges, doesn't say sorry, doesn't stop hurting you, or starts rationalizing, no, no, I did this because it was like that. Because you did this to me, that's why I did. If she's saying that, she doesn't belong here. She belongs here. Yeah, that is not a best friend. That is not the person who cares for you, loves for you, and values you. You value, you care, you love. No one cares for that. Yeah. You go to the tiger in the jungle and say that, hey, tiger, I care for you. I value you so much. You are such a beautiful tiger. And the tiger eats you. And then after a few years, the tiger and you both meet in the heaven and you say, tiger, hey, tiger, what are you doing here? I was valuing you so much and you ate me. That suddenly said that day. Then tiger will say, yeah, actually, I do that with everyone. Yeah, yeah, yeah. You were just food for me. So, yes, Dr. Tripti wants to ask one question. Yes, probably related to the same
Yes,
thing.
sir, the same thing. Yes, sir. What happened is last week I had a client who said that she and her best friend, they are not on talking terms for the last 2 years. And the reason is during COVID, friend A did not call friend B for her daughter's marriage because during COVID it was only 50 people to be called. So she was not among that 50 people. So on this petty issue, they stopped talking to each other. So now this friend A is very upset that so she's such a best friend of mine. I explained to her, I spoke to her everything. We clarified everything, but she said, okay, fine, it's okay. And now she's still not talking.
Ah!
So,
I will
so
tell now.
how do we?
Okay. Now there are two perspectives. There are two friends. One person who is hurt, other person who hurt the other. Yeah. So there is a monster, there is a victim. So you identify who is the monster, who is the victim. As a client, you ask both of them to come together or have a Zoom video call with combined both them. Okay. Victim and the monster. So you tell this victim, tell your heart, what is affecting you. Then she will say, she did not invite me, you were best friend, you were not supposed to do. Then this monster will show, I'm not a monster. Okay, I could not invite you. I wanted to do that. Okay, because of this reason, this circumstances, I could not do that. But I kept you in the loop. I kept you informed. If this monster has not kept in the loop or not informed, acknowledge it was a mistake. Okay, right? Now it is up to this victim whether to accept this friend, whether to decide. Now they have to decide whether our friendship is that strong that I can accept your lapse of one event. You were supposed to do something because of certain circumstances, you could not do it. Our friendship is so strong. If from this victim side, this person is still a monster, better you let it go. Then you break your friendship, go separate path. Okay. If you think that this is not a monster anymore, earlier it was a monster, now it is again my friend. I am not a victim anymore. Now I am equally friend. Then this friendship will continue. If this monster thinks she is a victim, if victim thinks she is a monster, nothing. Psychotherapy students, which is a technique you will use if they decide to separate? Psychotherapy students, those who are attending Sunday classes, which technique you will use to help them separate out? Very good. Help them separate out. Okay. Others, yeah. No, Dipti dear, your program is not that. Yeah. There was something I wanted to say and I forgot it actually. I don't know what was it. Don't call it ADSD. It is a natural part of life. Okay. So suddenly some people are like, sir, ADSD. Hey, come on here. What is this diagnosis game? You just want this, huh? To label some poor people, some decent people with ADSD, OCD, bipolar disorder. Don't do that. It is a job of wife to label people with schizophrenia, right? Not the student to do that. Okay. So this is a chapter of PTSD. Everyone will read this chapter. And if you have this diagnosis with you, you can heal yourself with Sunday classes and you can learn how to heal people also. Okay. How many of you who are attending the Sunday classes feel that these sessions are healing you? Please write down healing me. I got healed. Healed already. No, write complete sentence. Healing process going on. Healing means continuous present tense. Healed past tense. Write down all everyone getting healed, healing. Okay, healed completely. So this chapter, I got this. Very good, Rajni. Sunday classes for those who enrolled for that, dear. Okay. Okay. All those people who are learning, start helping people surrounding you. Whatever you are learning from the book, this book includes everything for psychology counseling for all conditions. all the common conditions. What are the diagnostic symptoms? How to counsel the client? How to manage the client? What are their common questions and how to handle that? Right. These things, while reading it, while learning one chapter, start helping people, those who are surrounding you. Start helping your friends, your colleagues, employees, managers, if you are a teacher, students and parents, okay? So that you can practice on the live clients. If you don't have client, if people don't value you because you are giving them free, you are saying, hey, come. I'll do some psychology counseling. They're like, hey, you need counseling yourself, get out. You need shock therapy, go to mental hospital. So if you have such people surrounding you, it's okay. There is still option. You can take my internship. Yeah. My internship is technically zero cost. You get the stipend at the end, you get the certificate that you did this internship plus this many clients you have managed. And after the internship, you can get empowered with me. There are presently 500 freelancers working with me, and those who get after the internship 40,000 to 1 lakh per month they are earning. So you can start internship and then get empaneled to start get paid clients. Right? You can continue doing internship as well as finally the paid client from 13 month with your present job or present uh, full-time mother. Whatever is your present occupation, you can continue to manage that because it is online consultations with online clients and decent enough. Even if you decide you don't want to earn money after 13 months, that experience of 12 months of helping people, healing them, and getting their blessings, yeah, when you the happiness, if you feel happiness by helping others, that is a good way to do. Okay, and this will be paid clients. So these clients will get benefit. You get the clients to practice on. Yeah. So that's a good way. And if you help strangers, that is better. Personally, I feel because the strangers are typically people, if they find 50% effect, they will say, ma'am, good session, ma'am. Thank you, ma'am. Thank you so much, ma'am. If they feel 80%, they will like, ma'am, you are the best, ma'am. I love you so much. And I like you, ma'am. And you helped me so much. I was going through this and this, ma'am. Abhi life सुधर ma'am. Okay. So you feel very happy that you are helped. But if you help your relatives, they are like, they will go to other relative and say, she has started some nonsense thing, and I don't know, she tried to make me buck or something, and I didn't like her. I think she needs some help. So they will do that. And then they come to you and you ask them, how was the session? They will say, it was good. So you know in your heart that it was very bad session. Huh? What is this? Come. So better you cut these relatives out of your home, out of your family, out of your mobile, out of your everything. Okay. So if someone says good. So it means ki either they are bad or either you are bad. Okay. So I have a protocol. If someone asks me any suggestion, sir, Pawan, can you give me suggestion? I say, no, I don't give suggestions. Yeah, I consult and you pay me the fees. I will do that. And because you are my good friend, I will charge you more. So typically that is a ball game your relatives play. Because you are charging probably, for example, market at 1,000, 1,500, something, you are charging 2,000. So your relatives will come and say, hey, can you charge me less because you are my friend? You should say, no, because you are my friend, I'm going to charge you more and double. And because you are my friend, you are going to pay me triple because you are such a close friend and you want to help me gain my confidence, earn some money, and gain satisfaction that I helped you so much. I was going to charge you only 1,000, but you are giving me 3,000. Good. If it is real friend, they will help you. If it is like the friend of the client which Dr. Tripti mentioned, they will run away. Yeah, they will say, no, I don't need any counseling now. Hey, you were asking suggestion, na? It means you need counseling. You decide. You make up your mind here. This is called dilemma. Okay, you make up your mind whether you want help or not. So it was like you want help but free. I don't do free. Yeah. So if it is your friend, your relatives, you should charge more. Yeah. Yeah. So I practice very less as a medical doctor, like only for government job, like 3, 5 years, something. And after that, I shifted full time to psychology. Okay. So now, so when typically people used to ask, they have that stomach ache, what they should take on phone or something, some relatives. So I used to say, you need to go to real doctor because now I forgot, I have complete memory loss, what I'm supposed to uh, do. Yeah. So you can go to some other. Okay. I used to be very polite and say that you can actually go to. It is very risky. So someone comes to you, ask medicine, and you give a medicine, something bad happens. Because of the medicine, you are at loss. Something bad happens, not because of medicine, but they blame you. That because of that medicine, I think that happened. Hey, come on, yaar. Why you ask me the medicine? Do you know what has happened in the clinical trial nowadays? I will tell you a very interesting story. You will leave everything behind now. Huh? You will lose faith in helping people. Listen to this. This is real, huh? Real now. In India, so every pharma company, everyone listen now, don't leave. So every pharma company, if you are busy, every pharma company all over the world, they used to conduct their clinical trials in India and Africa. Okay. Now, 10 years back, suddenly Indian government came out with a rule, law. Any patient, any subject getting into the clinical trial is guaranteed for 1 CR rupees if the patient dies during the experiment, during the clinical research. This drug is already proven, no problem. Then only they started this human trials, right? But now someone is taking a medicine for lipid lowering. Yeah, very good, very good. Now the person has a road traffic accident. Who's liable? The pharma company. Huh? You understand? So this pharma company is bound to pay 1 crore to this client because the client has died in the road traffic accident during the clinical trial. You understand? So any death, if natural death, for example, the patient is 60 years, already heart patient, dies during the clinical trial. So pharma company has to pay money. What is this stupidity? Because of that, since 2014, you will see many companies, they left India. They stopped doing their clinical trial. Almost 1,000 clinical trials will going on parallelly in 2014. Suddenly, everything stopped. Less than 100 now. That time. Okay, maybe less now. Yeah. Because you wanted to develop a drug, you were doing a research for something. The side effect is this 1, 2, 3. The side effect is not road traffic accident. The side effect is not death. But this patient has died in road traffic accident and you have to give the medicines. You have to give the compensation. Yeah. So that is so bad. So you should not do free. Number one rule. Yeah. Because if something goes bad, then they will blame you. Yeah. How many of you, if some food or something is left over, you give it to your maids? Write down in the chat, in the comments. How many of you do that? You, yeah. So if some food is left, you give it to your guard or your maid or pack it in the tiffin of your child and say, give it to your friends. Yeah. You are not that master. Yeah. There are some people, monsters, writing it. Sir, I do that. Pack it in the tiffin of the husband. What hopeless, the poor husband. Pack it in the tiffin of the husband, okay. Pack it in the tiffin of the someone you don't like in your family, okay. Good answers, very good, good. Not tiffin, are you sure? I think the husband is preparing your tiffin and putting in your tiffin. Ah, that dose is only that. If you're not putting in your tiffin, he's putting in your tiffin. So you need this book now. After this, you find out whether you trust your husband, whether your husband trusts you. I will give you a very simple, real scenario. You every day you give some food to your maid. She takes home. Her children eat. She eats. One day, she gets a food from some other place. Her children eat, and she also eats. All of her children, including she, because she is adult, probably has a good immunity, children get food poisoning. She will not blame that other food. She will blame you. You know, you give it to your guard, you don't know whether how much the effect is going to happen. Okay. You give it to your guard, the food is good, nothing has happened, but the guard will blame on you because the guard is looking for some extortion, somebody. Yeah. It has happened, the cases has happened like that. Okay. That some people gave some leftover food from some ceremony to some beggars. Okay. And one over smart so-called social activist or someone went there, saw that, protested that thing. Then this ceremony people should have host, they should have stopped doing it if someone is protesting. Why you go against that? Distributed the food to the beggar. This social activist, he incited all these beggars. You have to say only one word. You are getting stomachache. That's it. The social activist took the advantage of this scenario. 10 people he had to arrange saying stomachache, not on 20 beggars. And the host had the police standing in the front of their door and lot of bad publicity. So you don't want that, right? You don't want someone to get ill. The protocol should be, if you have a leftover food, put it in the dustbin. If you are such a loving, caring nature person, cook a good food, fresh food, extra chapati, extra food, and give it to your maid. Yeah. Why you want to give her a stale food? Because you want to feel yourself good that, yeah, you are doing some charity. It's not charity. You were going to throw it in your dustbin. That's why you are giving her. Okay. It is not charity. If you wanted to give something, you were throwing. That is not charity. Charity is something which you will give to other, what you are giving to your child and you. Right? So don't take the risk of giving to people. Yeah. We have a very strict protocol at home. Correct, Kelvin. Very good. The maid is maid. She's always going to say, yes, give me the food. Okay. But it is you have to decide. It's not a charity, it's not helping anyone. Yeah. If you throw it in dustbin, if you give it to her, same, actually. Yeah. If fruits, यार बड़ी बातें हो गई यार. Like if you decide to give fruits to the maid and they're like, yeah, actually I don't need fruit, I need roti, I need rice. Yeah, fruits is for rich people. Fruits is not to give to the maids. So fruits are not the thing they want. Yeah, you ask what she wants. She will say 10,000. Then you can see what you want to give. Yeah, or you cook extra food and give it to her. Any questions anyone has? Now, in the depression part, there are chapters which I have divided. I tell you depression, how it is divided in the book. Okay. You read it, we'll take it in the next class. All depression. So, depression is a huge spectrum. It starts from minor depression, major depression, bipolar disorder, depression in child and adolescent, then postpartum blues. Right? Pregnancy. After pregnancy, there is a sudden changes in the hormones after delivery, and sometimes woman may land up in psychosis or she may get into depression. Okay. During pregnancy also, because of hormonal changes, she may have land up in depression. Okay. So depression, minor depression, major depression, bipolar disorder, you need to differentiate between this because management is different. Then depression in children and adolescent. And the last one is depression related to pregnancy, which is presently lot of scope is there for you to help people in this segment. Okay. Substance use disorder, you can read it on your own. It's not a part of the exam. And very good. Rocky has asked a very interesting question. People go through that. I will take this, Shetty. No. So, emptiness syndrome is a grief. You watch my video on grief on the channel, you will find what is grief. Grief is not when the person dies. It is not only that. Grief is when you lose someone. That someone goes temporary. That someone goes permanent out of your life. So don't restrict grief to people who are gone permanently. The grief can be if your child goes for further education abroad, child gets married, living separately with their spouse, child moving to another city for the job, divorce custody battles, all those things lead to grief. Okay. Now think from the perspective of the child. You change the school, the child misses the friends. That is grief. I miss my friends. I miss my school. Yeah, beta, you are going through grief actually. Okay. You change the school because your job demands it to change. Okay. You change something. Okay. Now you among the adults you are fight with each other and you tell your child do not go to their family, do not talk to them. The child says, I'm missing them. Yeah, that is grief actually. So grief can happen because of permanent as well as temporary separation. Both the things, there are basic techniques and basic things which you should do and not do. They are mentioned on the channel. Grief counseling, Dr. Pawan Mittal, if you search, you will find that video. The second is you need some psychotherapy techniques. So in the Psycho Sunday program, there are 3 techniques for the advanced grief counseling. One is the, okay, people please write down what are the name of the techniques, psychotherapy students. Yeah. Hey, write down. I'm waiting for your answer. Which are the 3 techniques? Okay. Write down. More. Okay. I release you. I release you to release the person. Then the oasis to accept. See, grief goes through 5 stages, starting from denial. Okay. The final healing happens at acceptance stage. You cannot speed it up. You can facilitate. Normally, 6 weeks to 6 years. It can range for different people. So to move from denial stage to acceptance stage, the OASIS method helps, the OASIS technique. And the last one is talking to the angel. So those who have done talking with the angel with me, write down, could you talk to those departed? Talking with the angel is for departed, permanent. Could you experience them in a different plane? So what is the meaning? Those who are departed, those who left this mortal life, they are living in a different plane and you can actually communicate to them. All those students who are present and did talking to the angel with me, could you reach to that plane and communicate to them? Please write down. You could reach the plane and communicate to the, yeah, you could do that. Okay, very good. Very good. So this psychotherapy program, you will learn CBT, SCBT, subcognitive therapy, neuroplasticity, psychodynamics. So this is our copyright program, not available, the techniques are not available outside. If you wish to learn, you can talk to me. Yeah. The new batch will start from March. You can talk to me Monday to Friday, 1 to 5 p.m. I take only 1 batch in a year and 30 students per batch for this. Should we end the class? You enjoyed? Yeah. If you are watching this YouTube, write in the comment you enjoyed. If you are watching live, then write in the comment you enjoyed. And even if you say you do not enjoy, I'm not going to hold grudge against you, because I release you. For February exam going students, I'm going to send you the link of exam brief and videos you should watch for sample questions. There are some very interesting and most favorite students. What they do is they ask me repeatedly, sir, exam brief, sir, sample questions. And then I go back to the previous 23rd January message. I say, here, yeah, read, here, here. Yeah. No. Someone says, sir, I want to talk to you about exam. I say like here, here, here. So read it in the video. And then if you still have question, then you call. Fellowship students, you can talk to me for exam if you have the final exam. Okay. Final exam pattern I have not mentioned in the video. Okay. Thank you. So enjoyed. I equally enjoyed interacting with you. Very good students and good questions. Oh, yeah, Dr. Shetty is waiting for the question. Hey, I will take this. Hey, that is very wrong. So the question is whether you should have a different number for your counseling clients or your personal number. You should always have a different number. The simple reason is this number you don't want to leak it to the world. You don't want people to contact you anytime, day and night. So normally I have a different handset, okay, wherein this number and this complete handset is for clients. I instruct them, you cannot call me any odd hours, you cannot WhatsApp me odd hours and everything. But still there are some psycho clients, okay, you cannot do. So they are not going to listen to you. So if you call, no problem, you die calling. Okay. Some people they send 10 WhatsApp, don't worry. I will check WhatsApp when I start my mobile. That is my protocol. I will not check this phone at all. Number two, this number will get linked in the world. These are unknown clients. Now, some people may use it some bad way also. Okay, and you don't want to do that. Don't want to take a risk to leaking your number, personal number. Personal number should be restricted for your families. Okay, very close people, not your neighbors also. And the remaining number one you should keep for others. So I have three numbers. One is a disposable number, which I use to call this electric wala, plumbing wala, shop, vegetable wala, all this. This is a disposable number, right? Not on WhatsApp. Then there is a personal number, which is restricted to strictly 10, 15 people of my family. Then one number, which is restricted for clients. Okay. And I will check it only 2 hours in a day. I will not touch that phone other time. One number is for students. So students can talk me 1 to 5. But there are some students who WhatsApp me after 5. So I'm like, okay, typically I reply next day. But there are some interesting students, they WhatsApp me in the middle of night. So I politely say, don't send late night messages, even if emergency. And if you are emergency, you know what is the answer. You should go to your nearest hospital. So if you want to contact me, Monday to Friday, 1 to 5 p.m. Okay, I will talk to you. For all extra emergencies, visit your nearest hospital. This addition I have mentioned in the disclaimer also. Because while reading the book, you might get so excited. So I want to talk to you. I like you so much. I love you so much. You are written such a good book. Yeah, that's good. But you have to wait to express your love and happiness and respect. Uh, yeah. Okay. So thank you, everyone. See you. Have a great time. Bye. I will send.